Hey ladies, this is Kim Bukta making a second video today, just going over definitions of menopause and perimenopause. I just think it's important that women understand what these terms actually mean because up to a year ago, I don't think I really totally understood what was going on with menopause. I assumed it was a time in my life where I would just stop having my periods. I couldn't get pregnant anymore. I was maybe gonna have some hot flashes, and I heard I wasn't supposed to take hormone replacement therapy, and that's kind of all I knew. Obviously, since going through this, I've done a ton of research. Now I know a lot more, and I want to make sure other women are informed on what's going on in their bodies so that they can have discussions with their providers and know what they're talking about. So first off, we'll go through some definitions. Menopause is the one day in a woman's life where they've not had a period for a year. After that point, they can't have babies anymore, and that's when you're considered postmenopausal. So menopause is literally just one day in your life. In postmenopause, we spend about a third of our life in this time frame, which is a pretty large chunk of time, which is why it's important to kind of understand these terms and make sure we are getting the best information to talk to our providers about treatment options to make sure we live a strong, healthy life in this postmenopausal time. Perimenopause is the 7 to 10 years prior to menopause. And this is probably the most chaotic time for women when you have the most symptoms. This is when our hormone levels are starting to decline. It's related to our number of eggs. So women are born with the total number of eggs from the time they're babies, and they just lose eggs as we ovulate. We have about 10% of our eggs at age 30, and by the time we hit 40, we only have about 3% of our eggs. With the loss of egg number, we lose our estrogen production and our hormone levels drop. So this is where you start to have these fluxes of symptoms. Your body's trying to normalize and have normal periods. So you may have highs and lows of estrogen, which is what's causing these symptoms. And you literally have estrogen receptors on almost every organ system in your body, which is why there's so many symptoms. These symptoms range from, brain fog, fatigue, moodiness, anxiety, tinnitus, which is ringing in your ears, vertigo, which a lot of women have, heart palpitations, arthralgias, which are just generalized body aches, frozen shoulder, plantar fasciitis, Achilles tendonitis, tennis elbow, gas, bloating, urinary incontinence, vaginal dryness, pain with sex. And the list goes on and on because again, there's so many estrogen receptors on the body. When you start to lose this hormone, you can have a lot of symptoms associated with this. So this is the time where people are having a lot of these symptoms. One of the first predictors of women hitting perimenopause is abnormal periods. So irregular periods, shorter time frame, longer time frame, heavier bleeding. So this may be one of the first signs to know that you're hitting perimenopause. Another good indicator can be talking with your mom or your sisters. A lot of times there's a genetic component, so knowing when they went through menopause can sometimes be beneficial. When you start to have all these symptoms, it's very important that you meet with your provider, whether this be your family medicine doctor, your internal medicine doctor, your OB-gynecologist, to have them evaluate you, make sure they're running the test to make sure there's nothing else more significant going on. You don't want to write off that all these symptoms are related to just menopause and perimenopause because something else could be happening. So you really want to make sure you have the appropriate evaluation, you have, all the workup done, and once things are negative, then you know that, yes, okay, I'm in that time frame. This is probably related to perimenopause because my tests are all negative. I want to talk about the options of what treatments I can do to help with my symptoms, because there are good treatment options out there that a lot of times starting hormone replacement therapy can help with a lot of these symptoms. But again, it's very individualized, so you need to talk with a provider that is informed and can go over the pros and cons of starting hormone replacement therapy versus, the non-hormone replacement therapy options that are out there to help with these symptoms. So this was just a quick little clip of kind of definitions, hoping it can help you understand of what's kind of going on in your body, helping you to have informed discussions with your provider about treatment options. Again, if you like these videos, please hit subscribe. If you have specific questions, put them in the comments, and I'm happy to make short videos to kind of help address things, just trying to make things simplified for women to understand what's going on and hopefully help them when they're talking with their providers on how to ask the questions and get the treatment they need and get the questions they have answered. We'll keep making more of these videos to hopefully help out with that. Thank you.